Very interesting concern. But I have a question that needs a little clarification. How are we defining recovered? What are we using to say that people have recovered? I know that we are using the PCR. Remember that the PCR can also pick up dead particles. So that if we are using PCR as a measure of saying somebody has recovered, I think there may be some drawbacks over there. If you think about a resource poor setting like Africa, and you want to use PCRs to say that people who have tested positive have recovered, then we will say that a lot of the problem will just be using test kits when in effect they may not be helping us. So what are we saying? What's the Chinese using to say that people have recovered?
您好，由您刚才的这个问题，我们再衍生出来这另外一个问题，我觉得我们其实可以更加精准的定义什么叫做康复病人，因为我们过去是用这个，我听说在中国是用 PCR 的测试来确定这个病人已经康复的，但是我非常担心 PCR 的敏感度不是很高同时呢 PCR 也有一定的缺点或者是一定的这样一个问题所以我们是如何去判断这个病人是真正康复的呢？谢谢。
就是关于现在如何确定这个患者他是康复标准了这个 PCR 很多关于这个 PCR 的一些缺点除了这个问题，我们临床上还包括就是你要看病人他要症状体征要好，就是体温正常至少3天，他呼吸道症状消失，这是第一个第二个呢，就是我们还要结合他的这个 CT 他的影像学要判断他在明显的这个吸收。那么第三个就是关于这个核酸的问题，因为核酸它有一些缺点的话，我们现在一般来说至少连续2次核酸是阴性的，而且2次之间至少要间隔24小时。那么满足这几点以后，我们才让病人出院。
So I heard your question about the discharged patient and the recovered patient. I also understand the drawbacks of the PCR testing, but in our clinical research, we have 3 different golden standards for us when we are discharging the patient. First, the patient's body temperature need to be remained at normal for a consecutive 3 days with no symptom from their respiratory tracts. Second, through the CT scans, we should show that symptoms in their lungs, the different symptoms are being observed in their CT scanning. The third part is the PCR testing. We all understand the PCR testing has a limited sensitivity. That is to say, we have required twice of the testing, and the gap between the testing should be 24 hours. After the patient meet up with all these 3 standards, we can discharge the patient from the hospital.
对，还有补充的话，就是我们现在，让病人出院以后，我们在武汉让病人出院以后呢，还要让他在隔离点继续进行14天的这个医学观察和隔离。那么在这14天之中，还要再重复做几次核酸检测。如果确实没有问题，才让他回家。
And one thing I want to add up is back in the epicenter in Wuhan, we have actually let the discharged patient to under 40 days quarantine in a designated hotel. And during these 40 days, we keep a close eyes on the patient's medical performance, and we have conducted repeated PCR testing on this patient. After the 14 days and make sure there is no problem with the patient, we can finally discharge the patient back home.